Dear friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and our guest for today is Dr. Khalil. He is a psychiatrist at Thunder Bay Regional Health Science Center in Thunder Bay, Ontario, Canada. Today we are going to talk about eating disorders. Every day we are surrounded by the messages from television, movies and social media, and all these messages helps us or makes our body image or how we look upon ourselves. Many times a poor body image can lead to a serious disease which is called as eating disorder. Eating disorder is not all just about food. It also affects one's self-esteem, self-respect and can lead to serious disease. In the United States, 30 million people are affected with eating disorder. Statistics say that every 62 minutes, one person dies because of eating disorder related problem. Among all the mental illnesses, eating disorder has highest mortality or fatality rate, and hence it is very important to learn about eating disorder, and Dr. Khalil is going to help us to understand about its diagnosis, treatment and prevention. Thank you, Dr. Khalil, for coming to the show.
Thank you so much. It's a pleasure to be here.
Please tell us, what is an eating disorder?
Well, thanks for the opportunity. I believe that it's very important to learn and know more about eating disorders. And as you have mentioned, eating disorders have received media attention, and that goes back to the 70s, 80s and onwards. And that's because of death of high-profile celebrities. And many of the viewers, I'm sure, have heard about eating disorders or know something about eating disorders or heard about it from friends or family or read something about it. But what is really important is that we help our viewers and the public understand more how it is identified, how it's managed, and what are the best treatment options. So eating disorders, like you have said, are serious mental illnesses, and they are a group of mental conditions. All of them are characterized by what we describe as irregular or abnormal eating habits. And generally, all these conditions are associated with severe distress and also associated with unpleasant feelings, the way the person feels about his weight, his shape, and his appearance.
So what are the signs and symptoms of this eating disorder? If somebody has eating disorder, what happens to them in their day-to-day life?
Well, there are different types of eating disorders, and the main ones are anorexia nervosa, bulimia nervosa, and binge eating disorders. And each of these different illnesses have specific
different signs and symptoms. So what is anorexia nervosa?
So anorexia nervosa is an eating disorder that is mainly like the person who suffers from anorexia nervosa has really intense fear of gaining weight. Mm-hmm. And they pursue weight loss mainly through food restriction, but they can also use other behaviors, like, for example, what we describe as compensatory behaviors. They either force themselves to vomit, use medications like laxatives or diuretics or other pills to control their weight, or sometimes they exercise heavily. And even when they're underweight, they would continue to try to lose weight because of the way they perceive themselves.
They feel about themselves.
Exactly.
So how does it start all?
Well, it starts with the individual having really unusual or abnormal perception about the way they look, about their appearance.
They feel about themselves.
And what is very important to know, and that's something that was minimized in the past and now it's become more important, the psychological component of eating disorder. Because what has been kind of through research and through studies, now it's been identified that a person, for example, with anorexia nervosa, they feel that their self-esteem or their self-confidence is hugely undermined by the way that they feel about their shape or weight.
They will restrict themselves
Exactly.
in eating, they will take laxatives or vomit or...
Correct, in order to control and to achieve their ideal weight in their mind. Yes.
Right. And then you mentioned about other disorder, bulimia nervosa. What is that?
Well, bulimia nervosa is another eating disorder, and that's mainly characterized not by like the intense, there's also fear of weight gain, but it's also associated with recurrent or frequent episodes of what we describe as binge eating. And that means that the individual will consume
lot of food.
Huge amount of food over a relatively short period of time, and without having the ability to control their eating. And subsequently, they will feel quite distressed, guilty and embarrassed. And again, the compensatory behaviors about wanting to lose weight, it goes almost through a circle through a cycle.
Right.
So almost because of the way that they feel guilty about their eating, they will then resort to these unhealthy behaviors.
So these are the two more common type: anorexia nervosa and bulimia.
Correct, but there's also the binge eating disorder.
What is the binge eating disorder?
Well, the binge eating disorder is like similar to bulimia nervosa, but it's mainly the person who suffers from binge eating disorder mainly engages in binge eating.
Eating a lot of
bouts.
food.
So eating lots of food, lots of kind of calories over a limited
Short
period of
period.
time without having the ability to control their eating. And again, they will feel quite guilty, embarrassed, and really ashamed about their behavior. And what's important to mention about all eating disorders is that because of the way that the person feels guilty about their behavior, many patients will try to avoid being found or kind of witnessed by other people. So many of the behaviors, they do it in a secretive way. And they will avoid kind of being involved in kind of...
People don't come to know about it.
Exactly. And they wouldn't go out to eat with people, for example, and they will be more likely to be socially isolated. So the behaviors will not be easy to detect.
So how common are these disorders in your practice?
Well, I don't know, I don't have the exact figures for Thunder Bay, but in general, we know that eating disorders are not uncommon conditions. And like you've said, because of the serious consequences that can happen with them, they require attention and treatment. Anorexia nervosa, depending on the type, anorexia nervosa, I think there has been more recognition. So the number of people during their lifetime who can be affected by anorexia nervosa is about probably less than 1%, but that's like 1 in 100. For bulimia nervosa is about 3 to 4%, and about the same or slightly higher for binge eating disorder. So slightly lower for anorexia nervosa, but it has the highest mortality.
Right. Now, among age groups, which age groups are commonly affected with these disorders?
Well, actually, they can present at mostly any stage of life, but
young age, like
younger ages more likely, late teenage years or teenage years, and early adulthood, and that's mostly the case for anorexia nervosa.
Are the girls more affected with boys? Any such statistics?
Yes, but I believe that the males are becoming more significantly affected by it. I mean, in the previous data used to kind of indicate that it was like almost 10 times more likely with females. Newer kind of research shows that the proportion of males affected is getting higher.
We'll take a short break and we'll continue our discussion after the break.
Sure.
Please stay back for the next part. Thank you. Dear friends, welcome back to the show Talk with Your Doc. Today our guest is Dr. Samir Khalil, and we are talking about very serious mental disorder which is called as eating disorder. Dr. Khalil, when somebody has been affected with any of these eating disorders, what are the questions they can ask themselves and know that they are affected with the disorder?
That's a very good question, because like I said, it is a very difficult condition sometimes to identify, and sometimes it's difficult even for the person affected by it to really realize it or appreciate the degree of illness or the potential consequences. So the best reliable method to make a diagnosis is through clinical assessment.
Yes.
However, like if someone has any particular worries about their eating habits or their appearance, or like they feel that they have unhealthy mix of behaviors, thoughts or emotions regarding their weight or their eating, then there are some kind of screening questions or screening questionnaires that they can ask themselves so that they know whether there are some of the symptoms of eating disorders, and then they can get help. So there is
Screening questionnaire.
exactly, and there's a questionnaire called the SCOFF questionnaire.
SCOFF.
SCOFF. That's correct. So it's an acronym, and each one stands for a keyword in 5 questions.
Yes.
And the questions are the first one is that do you make yourself sick when you feel uncomfortably full?
So S for sick.
As for sick. C is that do you worry that you have lost control over the amount of food you eat? So the C is for control.
Controlling in eating.
Exactly. O is for 1. Have you lost 1 stone of weight in the last 3 months? F is for fat. Do you believe that you are fat when other people think that you are thin? And the last F is for food. Do you believe that food dominates your life?
All the time you're thinking about the food.
Exactly. So the acronym works really well in English. Obviously, when it's translated, doesn't work as well. But still, the questions can be adopted in different languages.
Yes.
And if someone answers yes to 2 or 3 of these questions, maybe they need to read about eating disorders, and maybe they need to speak to someone about it and to get help for it.
So if somebody has one of these SCOFF questionnaires, they feel that those questions are relating with them, what should they do? Go to the psychiatrist or psychologist or family doctor? How should they approach?
Well, the first point of contact would be the family doctor. And obviously, that's when they can discuss their concerns and have like some evaluation. And it's important for any person who suffers from eating problems or weight problems that they need to see the doctor to make sure that there's no other underlying illness like physical health problem.
Right.
So that also needs to be ruled out.
So is the weight loss a key feature of all these disorders? Like people lose the weight, patients affected with disorder lose a lot of weight?
Not necessarily. It's more likely with anorexia nervosa. With bulimia nervosa, there will be more weight fluctuations. With the binge eating disorder, it's more likely that they can become overweight.
So with anorexia nervosa, there is extreme weight loss in some situations.
Exactly.
So what are the consequences of this weight loss?
Well, it can be obviously very serious, and if the person is severely undernourished, they can feel they won't be able to really function in life. They have extreme tiredness, lethargy. They may be more likely to have problems with long-term consequences like bone loss, infertility. They can also have sometimes imbalance in the electrolytes, especially if they force themselves to vomit, which can lead to some heart difficulties at times.
Heart rhythm?
Absolutely, and that can be potentially very dangerous and very serious.
So what is an ideal body weight one should aim for? How do we calculate the ideal body weight? Because everybody worries about the weight.
Exactly, and that's the really $1 million question. But I mean, it really varies. There's no ideal weight that it depends on the individual, because there's so many
methods,
factors really, depending on age, gender, the proportion of fat or muscle in their body. But what is like scientifically proven way of finding the range of weight that's healthy is there's a measurement called BMI, body mass index, which is kind of calculated by dividing weight by height in meters squared. But if someone goes online, even if they have their weight in stones or height in their feet, there's a formula. They just put the numbers, and the normal range is between 18.5 to 25.
But if it is high BMI, then does that mean there is a high body fat, or it might be high BMI because of some other factors?
Could be some other factors, but that's like more like indicating that there can be higher body fat kind of proportion.
Yes, yes. Now, are there any different degrees of eating disorder, like mild, moderate, severe? Or?
Yes. There are different degrees, and obviously depending on how severe the eating disorder, then the management plan will be then.
How do you know whether we have entered into a serious eating disorder problem?
Well, obviously, when there are like complications, especially whether they are psychological or physical complications, because eating disorders not only they cause physical health problems, like I've mentioned, but they can cause psychological and emotional problems, like depression, anxiety, or even self-harm, suicide, drug abuse. So all these complications make it more serious.
So eating disorder can lead to all these serious consequences.
Correct.
So that leads to a serious problem then.
Correct.
Right. Now, what are the investigations or tests a doctor does when a patient goes to a clinic?
Well, there are many investigations that need to be done because eating disorders can cause physical health problems. The medical care is important, and these investigations, there's a list of investigations just to make sure that there's no underlying health problem, but also to evaluate the impact of eating disorder on the individual, like blood count, hormonal levels, status of nutrition, also investigations to make sure that there's no bone loss, heart rhythm abnormalities, all of that needs to be kind of carried out.
Right. Now, a question is, what is the primary cause of all these disorders like anorexia nervosa, bulimia nervosa, or binge eating disorder? What is the root cause of all this? Is there any genetic cause or behavioral cause, or?
We know that eating disorders, like they are like complex conditions. There's no exact
Multifactorial
cause, so multiple factors. Like you've mentioned, there are genetic factors. Sometimes it's related to personality, kind of, or personality traits. It can be also caused by a number of psychological or social factors. So, for example, psychological factors like poor self-esteem, low self-confidence, social factors like cultural pressure, peer pressure, working like in certain professions like a ballet dancer or models can increase the risk of eating disorders, life traumas, difficult family relationships, even significant changes in life, starting a new job, starting university, leaving house. All of these factors
maybe school bullying also might be one of the causes.
Certainly.
Some children might be bullying others.
Absolutely.
And might lead to the
that can be a very serious cause for triggering or precipitating eating disorders.
I mean, eating disorders are pretty serious in some cases because it can lead to a death also. So.
Absolutely.
Yeah, and it is a social problem as well, right? The whole family gets affected when there is a...
Absolutely, because not only the person, but also the family, the loved ones will become affected.
Everybody has.
Absolutely.
We'll take a short break and we'll continue our discussion. Please stay back for the last part of the talk. Thank you. Welcome back to the show, Talk with Your Doc. Our guest today is Dr. Samir Khalil, and we are talking about eating disorders. Dr. Khalil, we mentioned about signs and symptoms. What are the investigations involved? Can you please tell us about the treatment options available for all the 3 eating disorders?
Sure. Obviously, once the diagnosis is made, then the treatment must start. And although we spoke about how serious mental disorders are and how kind of significant the consequences, but they are treatable conditions and there are effective interventions that can resolve the problems and prevent the serious consequences. So the management for eating disorders obviously depend on a number of factors. First of all, depends on the type of the eating disorder and also depends on the severity. But generally speaking, for like most eating disorders, what is essentially important is the medical care and the physical health monitoring. And because of the potential complications, any person with suspected eating disorder must undergo physical examination, investigations, including blood investigations and also other investigations like ECG or electrocardiogram to check the rhythm of the heart and just to have a full evaluation. So that is very important. And many of the complications can be hidden and it's not easy to identify without these investigations or these tests.
Correct.
So that's an important part of the management plan. Further treatment will depend on the assessment. So obviously it's important to agree on a plan with the patient that will meet their needs, because they would have ideas that they know more about their illnesses and
Yes.
their conditions than anyone else. So the management can involve not only the family doctor, can all involve many other professionals, because eating disorders are complex. So there can be a role for example, the psychiatrist,
Psychiatrist.
a nutritionist, or a dietitian. There can also be a significant role for the psychologist.
Psychologist. Correct.
So multiple health professionals can become involved.
Mhm.
And part of the treatment will involve identifying what is the best setting for providing the treatment. So is it ideal to do it in the community, or it can be done in the outpatient clinic, or in group settings, or as a part of a family, or whether it's necessary to do it in hospital.
And this is all individualized treatment.
Absolutely.
There's no general protocol as such, but
Absolutely.
now
So
what sort of treatment, like medical treatment you say, is there any medications or tablets available, or?
sure. I mean, just to mention about the hospital, it's not needed for most people, for most patients with eating disorders, but for the small minority, it's really necessary. Medications have a role. They are not the first option for eating disorder management. The first option is psychological treatment.
Psychological treatment.
But some medications can be helpful, especially antidepressants. And they're very helpful, for example, when there's a coexisting depression or anxiety.
Mhm.
And actually for binge eating disorder and for bulimia nervosa, there are now newer medications, including the antidepressants, that can also help reduce the intensity or the frequency of the compensatory behaviors, the forced vomiting and
Right.
the regular use of laxatives or drugs to control weight. So medications have a role, but they are not like the first option.
So main option is the counseling probably.
Absolutely.
Now is this the individual counseling or the family counseling involved?
Well, it depends on the patient. There's more evidence to support family approach for younger patients,
Yes.
especially with anorexia nervosa. However, counseling or psychotherapy is important for all patients with eating disorders.
So what is involved in the psychotherapy? What is counseling involves?
Well, counseling involves involves talking therapy. So the person will speak with a therapist who's experienced in the field of eating disorder management, and it's mainly about learning new strategies to cope. And really, the issues that we have talked about, like for example, the way they perceive themselves or their weight or their appearance, or how they feel that their self-confidence or their self-esteem is totally undermined by their their perception of how they look. Psychotherapy will address these concerns.
Right.
So it will help the individual learn a new healthy way of coping
Right.
with these concerns, these emotions, and to learn new strategies to manage the negative emotions, negative feelings, and the distress caused by the eating disorder.
Right. So first is the counseling or psychotherapy, and if that doesn't work, then you go with the medication probably?
Well, it can be combined.
Combined together.
Both medications, but psychotherapy is the mainstay treatment.
How long is the psychotherapy treatment like?
Well, it varies. Obviously, it depends on the individual. Like, for example, we said that there are many factors that can lead to eating disorders, like traumatic life events, change in life circumstances, difficult family dynamics. These also must be addressed during psychotherapy.
Yes.
And if there are multiple factors, then obviously that will prolong the duration of therapy. So yeah, it depends on the patient, but at least it will be several weeks.
Now, once with the psychotherapy or counseling, if the patient gets better, does it comes back in the life at a later phase of the life?
There is always
Relapse?
a risk of relapse, and I think what also is important to mention is that the nutritionists also have a role, and also weight restoration and stabilization of weight is also very important. And in order to achieve the target range for, like what we said, BMI, then there should be some support for the individual to see to have healthy relationship really with food and to achieve that target. And in order to sustain that, many patients, and actually most patients, like probably everyone, will be encouraged to read about their condition and just use what we call self-help manuals in order to really solidify the strategies that they have learned so that they can continue to remain well and prevent relapse again.
So if somebody's family member is affected with this eating disorder, one of this, how can a family member cope up with themselves and help the patient?
Can be very difficult.
Very difficult.
For sure. Obviously, it's harder when the person doesn't see the effect of the illness and how it's impacting on them. Obviously, it comes with encouragement. And if the family member or the friend suspect that there are some signs or symptoms of eating disorder with someone they know well, then the first step would be to encourage them to go and speak with their doctor, speak with their family doctor and seek help. And to reassure them that there are effective treatment options and that their health can recover.
And family members also might need some counseling help probably.
Certainly, and like we've mentioned, there's the option of family therapy, which will involve family members to discuss about what led to the eating disorder, what it means to have the eating disorder problem,
how to cope up with it,
and how to cope with it and manage it, and how to develop new strategies for the entire family and the patient too, because the family is one unit and it can affect all individuals.
It's pretty serious disorder.
For sure.
Thank you, Dr. Khalil, for enlightening us on a very wonderful topic here. Thank you so much.
Thank you so much.
Thank you everyone for joining for the show.